Hello, 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 and welcome on this bright and wonderful afternoon. Happy Mother's Day to all the mothers out there. Thank you so much for joining us. And I've got Dr. Monisola Adanijo with us today, who I'll be introducing very shortly. Thank you so much, Dr. Monisola, for joining us this afternoon. So, did you know that heart disease is the number one killer for women worldwide? More than 35% of female deaths are due to cardiovascular disease. And some women don't even recognize the symptoms when they are going through some very life threatening situation. Welcome once again to How Do You Keep Well podcast, where we unlock the secret for feeling amazing in your mind, in your body, and in your soul. My name is Dr. Jaye, as usual. I'm your host, I'm your cheerleader, and I'm your guide as we navigate this fascinating world of women's health and well being this season of this podcast. If you're ready to laugh, if you're ready to learn, and if you're ready to take charge of your own health, you have come to the right place. Now, I was talking earlier about cardiovascular disease and cardiovascular death. Did you know that one in three women will die from heart disease? And yet, more than half of women who go to see their doctors are often still misdiagnosed after a heart attack. Some women don't even know they have symptoms because they often show up as other things, fatigue or nausea. And it's not, sometimes it's not just that heart clutching moment that we see in Nollywood or Hollywood movies, every day. But the question is, why is this still overlooked, and why do people not present at the right time, and why are people not looking? Why are women not looking after themselves? So today I'm joined by Dr. Adanijo. She's a consultant cardiologist, and she's also a heart health coach. We're going to be busting common myths, and we're going to be discussing why women are underdiagnosed, and we're going to be sharing some simple science backed habits to keep your heart strong. So stick around. This is a conversation you don't want to be missing, and it's a conversation every woman needs to hear. So let's dive in, and please welcome Dr. Monisana Adanijo into our studio. Drum roll. she's going to be she's going to be breaking down. I can't wait to hear her speak. Thank you so much, Dr. Moni, for honoring this invitation. I'm so excited to speak to you. So before we before we dive in, please tell us a bit more about yourself. How did you end up being a cardiologist and a cardiac health coach?
Okay, so thank you so much, also Jaya, for inviting me. Hello, everyone. I'm so glad to be here, and I'm honored to be a guest on this podcast. Now, the question is, how did I get to be a cardiologist? Oh, it's very easy. When I was doing my internship, it was in cardiology unit, and I enjoyed the way the consultant used to approach heart disease. He made it simple, he broke it down in a very easy way, and I found it very interesting. So that's how come I'm a cardiologist. Now, why am I so into preventing heart disease and helping people live better lives? That is because I've had so many experiences, in my practice in cardiology. I've seen young people die from heart disease. I've seen people, die from things that could easily have been prevented. I always tell the story about this couple who the husband had a stroke on their wedding day during their reception, and the man was in his 30s, the lady was also in her maybe late 20s, early 30s. Imagine spending your wedding night on admission in the emergency room, only because he didn't know he was hypertensive, he was obese, he didn't eat right, and he had a stroke right there during the reception. So, that really touched me. And I said, you know what? I need to talk to more people about why they need to prevent heart disease. So that's it.
That's amazing. I wonder where you did your internship because me, when I was doing cardiology rotation, it felt like the hardest thing to do. There were so many wires and lots of different things hanging from here and there. But and the ECGs were always so like goodness. But after a while, I got a hang of it. But
Exactly.
your consultant must have been a very good teacher.
He was. Well, he is. He's still alive, so he is.
That's amazing. That's amazing. So we're going to go very quickly into the rapid fire, and I'm going to be asking you some questions. Now, the title of this episode is, 10 signs women should not ignore. About their heart health. And during this rapid fire, we're going to be debunking some myths. So there you are. Whilst you listen to this rapid questions, I want you to start getting some ideas of what we are going to be talking about today. So, Dr. Moni, number one, if I feel fine, does that mean that my heart must be healthy? Yes or no?
No, no,
Okay. Now,
no. Mm.
the second question is this. Um, is it only older women who need to worry about heart disease?
No.
Okay, you hesitated there a little bit, so we are going to find out why you hesitated. Now, the third question is this: hormones don't affect my heart. Yes or no?
False. They affect your heart.
False. There
So
you
I guess
go.
that's a no
They
because
affect
they
you.
affect your heart, yes.
Yes, false. That's the that's great. And of course, we're talking about hormones. We've not specifically said which hormones, but in general, we have so many hormones in the body, don't we? We've got the female hormones, we've got the thyroid hormones, we've got all sorts of different hormones, right? Now, the
You're
next
right.
question is this: a little high blood pressure isn't a big deal.
Ah. False. False. Oh. No way.
Hmm. So I agree completely with that because sometimes some people, when you've checked their blood pressure, they say that's still okay now.
Mm.
Yeah,
But they
that's
say it
the
was higher
beginning
last
of
week.
something. Yes, I can hear you, Dr. Mani. What were you going to say?
I said, or they'll say it was higher last week. This one is small.
Yes,
It
that's
was higher
another thing
last
I
week.
hear. Last week, yes, I heard that one as well. Like whether it was high last
Yeah,
week or this week, you have high blood pressure.
exactly.
Now, the next question is this: if I have a normal ECG, that means my heart is fine.
False.
False. That's true because there are still things going on in the heart,
Oh.
especially as you go through midlife. Now, the next question is this: heart disease runs in my family. There's nothing I can do about it. It's going to happen to me.
False. False. Very false.
False. Very false. I like that answer. Now, the next question is this: heart attacks always start with chest pain.
False.
False. There you go. We will be talking about some of these things later on in this program. Now, women's heart attacks are more dangerous than men's.
True. And I'll tell you
True.
why.
There you go.
But this is rapid
Oh,
fire. Yeah, true.
I can't wait to hear that. Drinking wine every day is good for my heart.
False. 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 False.
Wow, wow, wow. Thank you so much, Dr. Mani. Now, I want us to go back to one question. You said that you want to tell us why women's heart attacks are more dangerous than men. Can we start with that point this afternoon? Can you please tell us a little bit more about this?
Okay, because I said it's false because women don't have the classic heart attack symptoms. So many times heart attacks in women are missed. They call it different things. Some can say it's just anxiety. Some can say, oh, you are just tired. Some will say, oh, it's because of your hormones. Some will say it's that time of the month. If you're no more seeing your period, they'll say, oh, it's because you are menopausal. Some call it ulcer. Some they can say it's just neck pain because women don't have the classic chest clutching drama chest pain that men have. Many times when women have heart attacks, it's silent. That means they may not even have any symptoms at all, or they have vague symptoms, just nausea here and there, dizziness. Some even have tummy ache. They don't even have chest pain. Some can just have jaw pain. So, they have vague symptoms. So, unless you're really looking out for it, unless you're really sensitive, you may miss it. And then you miss the window where you can help the heart
Mm.
improve. And the woman now goes on to have complications of heart disease without even knowing she has had a heart attack before. So, that's why it's more dangerous because it's easily missed.
Hmm. Hmm. Now that is very interesting, and I guess that's where some women um actually struggle, because most of them don't realize or don't recognize the symptoms as something quite dangerous. And of course that means they are not diagnosed properly. I even find some women underplaying their symptoms when they come in to see me, and they
Yeah.
say, oh, no, 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 I had it that's the same way last week, and I was fine.
Mhm,
I just took some Gaviscon or something like that, and everything settled very quickly.
mhm,
And I'm there wondering, wait,
mhm.
wait, wait, why didn't you ask for help? You should have at least asked someone if you were not too sure about what was going on. Is there a way? Is there kind of some warning signs some women may experience that may help them recognize that, oh, look, this is a little bit unusual. I should go and ask for help.
Okay, so first of all, heart attacks don't come out of the blue. You can't be minding your own business and you have a heart attack. There has to be some predisposing factors in place or some risk factors. So if you're a woman that have risk factors for heart disease, okay, then you need to be extra careful. So what are the risk factors for heart disease? First of all, family history. If you have a family history of heart disease or stroke, then you're at risk of having it yourself. Not I said at your risk. I didn't say you definitely have it.
Mm,
Now, of course, the
mm,
older you get, if you're postmenopausal, then you are more at risk of having heart disease because estrogen, which young people have, is a protective. By the time you're postmenopausal, then you have as much risk as men, okay, for heart disease.
mm,
Then, of course, if you're hypertensive, if you're diabetic, if you have high cholesterol, if you smoke, if you're in the younger age group and you use oral contraceptive pills, if you're on drugs, recreational drugs, cocaine, heroin, marijuana, all these things can predispose you to having a heart attack. So heart attacks don't just
mm,
happen. They happen on a bed of pre-existing conditions. So you
mm,
need to even know you have a pre-existing condition before you know what to look out for. So do you know your blood pressure? Do you know your blood sugar? Do you know your cholesterol? What is your weight? Are you overweight? Now, if you have one or more of these risk factors and then you start having funny symptoms, you can't explain this nausea, you can't explain this dizziness, you're just dizzy, you're just always tired, you have difficulty breathing, you know you have pain in your tummy that just is not going away. Some people still have that chest pain even as women, so it's not like women don't have it at all. So you have this chest pain that comes on with activity, is relieved by a rest, it radiates to your jaw or down your left arm. You need to take it seriously. And I know because
mm,
women, we tend to not ask for help. For some reason, women think being strong is a badge of honor. Culturally, we've been socialized to be strong, to carry the family, to lift everybody up. We're taking care of everybody but ourselves. Women will bring their husbands to hospital for the slightest problem, but they'll downplay their own issues. Once their child has a little cough, they're in the emergency room. But the woman that is carrying this child that is just madly sick is dying inside, but she will never complain about herself.
mm,
So, so you need to know
mm,
your risk factors. You need to go for your health checks, to know whether you have these risk factors. And you need to, pay attention to your body. Once you feel unwell, please seek help. It may be nothing
mm,
and it may be something.
mm, mm. Yeah, I find that really interesting because I think both of us are mothers, Dr. Moni, and it's so easy to focus on other people in our lives and, put so much emphasis on their health and their well being whilst forgetting about ourselves completely. And I mean, especially when the kids are younger, many women don't sleep very well, and this carries on, as they get older. So many women don't sleep well, constantly managing stress of life, stress of children, stress of work, and of course, the diet is kind of completely out of the window. Now, do you think is there a particular point in time when women should begin to feel like, well, you know what, this sleep or the way I'm managing my life right now, I am heading the wrong direction? Should they be
Mm.
waiting to actually get symptoms, or at what point do you feel that women really need to start looking at, all of these little factors, especially when they are at risk, like you mentioned, the family history, everything you've talked about, the blood pressure, the cholesterol? At what point do you think they need to start taking action?
To be honest, your first symptom of heart disease may be a bad complication or maybe death. So you cannot wait for symptoms to happen. So I think self-care is important for everyone. And I think as mothers, we need to give examples to our female children because they're watching us. Many of us behave like our mothers did, and we need to learn to break that cycle. It's true. Many of us, for some, I was on social media today, and because there's Mother's Day, almost all the posts were talking about how women sacrificed, and I'm like, why do we describe mothers with hardship? Why don't we describe mothers as, oh, you used to play with us, you used to take us to the park, you taught me how to rest? Almost all the posts were like, oh, you gave up your wrapper so I could sleep, you sold your earrings so I could go to school, you gave up your food so I could eat. Honestly, I think we need to start changing that narrative.
Hmm.
We
Hmm.
need to take care of ourselves from when we're young. And I think our generation, we need to give our daughters, better examples. So we need to take care of ourselves. And I tell people, your house will not burn down, your kids will not die if you take a day off. I have two children, and I raised them in a very atypical way. My children never slept in my bed, even from when they were babies. They always slept in their cot. If you like, cry from now till next week. Once you're fed and your diaper is dry, you will sleep in that cot. After a while, they got used to it. They got used to it. And the main reason why many mothers don't sleep is because the child is in bed with you. So you
Hmm.
cannot sleep. You are trying to make sure you are not rolling over and sleeping on this child's head. So even though the child is not crying, you're not rested because you're trying not to harm this baby, sleeping beside you. And then we don't trust people with our children. you know I'm not saying the world is good, but there must be one person you can trust with your child, even if it's your husband. Some women don't even trust their husbands with their children. You don't trust your own mother with your children. You don't trust your sister with
Hmm.
your children. So there you
Hmm.
are, you're struggling with work, with everything, trying to cook. Only you cook, clean, I take care of. I beg now. I always thought whenever I talk with younger women, I tell them there is no award for the most harassed and stressed woman. There's nothing like that. There's nothing like that.
Absolutely.
You need to learn to
Absolutely.
ask for help. I need to
Hmm.
prioritize self care. It's important.
Hmm. I think, it's very easy to think, yeah, I can do it by myself, and we all vary. Obviously, there are some women who feel like, yes, they have to do it by themselves, but also the situation around you, the environment, like we were talking earlier on. If you're abroad and you don't have family or relatives around you, you may struggle to do certain things, without having to ask or pay so much money. But then this is all the burden, and I always say to people, midlife is the accumulation of stress that you have built up over a
Yes.
period of time. Now, this stress does not just go away like that. It causes a lot of internal inflammation, within your body. There is the acute inflammation where, you just have a tiny wound, your white cells and the normal cells that fight infection come, they fight the infection and they get rid of it. But there is that internal inflammation that you cannot see, but it accumulates over a period of time, such that the process of the life that you have lived over 20 or maybe 15, 20 years of raising your children, you begin to feel the
Mm-hmm.
effect of it in midlife. And that is why the heart
Yeah.
is aging a lot quickly, and then you're struggling to do so many things. Now, the other question I have for you is about stress management. We've talked about, but I really want to know the impact of stress. And I want people out there to know what the impact of stress can be to the heart, because not many people recognize. I mean, some people recognize it. They say, oh yes, my blood pressure is high because I'm stressed, and that is good. But not many people recognize the impact of all these silent stresses, this
Mm-hmm.
keeping it in and these sacrifices, the impact it can have
Mm-hmm.
on our cardiovascular health. Dr. Moni, can you just break
Okay.
that down a little bit for us?
Okay, so we all know what happens when we are stressed. Let's say, for example, something happens quickly. Typical example: someone slams the door, you know, and you hear that loud bang. Your heart rate goes up, your blood pressure goes up, and that's because when you're stressed, your body releases hormones. We talked about hormones before. Now, women only think about female hormones. There are different hormones in the body because your body is governed by hormones. Now, the body releases hormones, adrenaline and cortisol. Those are the more prominent ones. And what does adrenaline do? It increases your heart rate and increases your blood pressure. What does cortisol do? Cortisol also raises your blood pressure. Cortisol now increases your blood sugar as well.
Mm,
Okay. Cortisol helps you store fat, store energy as fat in case you need to run or you need to, move quickly. Okay. Now, there are also all other hormones that narrow your blood vessels. Cortisol increases sodium and water absorption from your kidneys, increases your blood volume, increases the pressure in your arteries. Now, when this happens for a short time and the stress ends and you relax, all these hormones go down and all these changes go away. Now, if you are stressed for a long time, long term stress, stress is going on for weeks and months and years. Now, stress also includes not sleeping properly. Now, if this goes on for weeks and months and years, what happens? You accumulate fat around your abdomen. Okay. Because you've
mm,
accumulated fat around your abdomen, you become insulin resistant. Your heart rate is
mm,
persistently high. And there's something called tachycardia induced cardiomyopathy. That's a different heart disease on its own. Because your adrenaline levels are high, your blood pressure goes up and stays up. Because of all
mm,
these stress hormones, your blood vessels narrow and stay narrowed, also helping to push up your blood pressure. Because stress hormones are high, you keep on retaining sodium and water, okay, increasing your blood volume and increasing your blood pressure. So over time, when you don't rest, you don't relax, you have chronic stress. You end up being obese, diabetic, and hypertensive. And those three, of course, are the
mm.
unhealthy cocktail for heart disease to develop.
Wow, that is you've explained that in such a concise way, but very easy to understand as well. And I quite like the fact that you've brought those three, almost like those three metabolic symptoms into this. And it's so easy to see the link between stress, obesity, high blood sugar, and hypertension. And when we look around today, look into most middle-aged women, I see a lot of middle-aged women who have all three things, but yet they don't recognize that this is a big issue that they really need to. And no wonder it is almost like a silent killer. I mean, heart disease, cardiovascular disease kills more women than cancer, mainly
It
for this
does.
reason, isn't it? Because the accumulation of stress over a long period of time is causing all these changes, internal changes that sometimes only come to the fore in midlife. That is incredible. Now, thank you so much, Dr. Moni, for explaining that so easily to us. If there was a simple habit that can improve heart health in 5 minutes a day, what would you say that would be? Or perhaps, maybe let me make it simple. Are there maybe any top health habits that you would recommend that people really need to be doing regularly to prevent this accumulation of stress or accumulation of changes in the body?
Okay, so very easy. Out of the bat, we need to eat properly. Okay, we need to watch our diet. We most women eat whatever is left when everybody else has eaten, and that's wrong. Number one. Number two, we need to be active. We need to exercise. Many of us are so tired after doing I don't know what. We sit on the couch all day and we do nothing. You know, we need to be more active. We need to sleep better and we need to manage stress better. If this is all we do, then I think we're on the right track, to preventing heart disease. And of course, maybe this is not an everyday thing. We need to know our numbers. That's a once a year thing. We need to know our numbers and we need to make sure that they are normal, our health numbers.
I got the diet, which is one of the things that I know you talk a lot about. Um, and I know you talk a lot about processed food, processed,
Ah, yes.
diet. I mean, personally, I remember growing up in Lagos, in Nigeria, and we even though there was Mr. Biggs, it was just Mr. Biggs at the time. That was all. But now there's so many outlets and shops and all of these places that sell all this highly processed food. And I know more and more people are exposed to highly processed food, very quick meals, 5 minutes food, 10 minutes food, partly because of this busy lifestyle that many of us have nowadays. You really want to quickly cook something for your kids, eat. But one of the things I also like that you mentioned was, the fact that moms eat everybody's remnants. And I think that is so true. I'm even guilty about that. Can you break that down a bit for us? Are there some food that we can eat that is a bit more healthy or that would help our hearts, the way our heart works, a bit more?
Okay, so to be honest, traditional meals are still the best. Okay, I'm not asking you to go and buy fancy food or anything that is, too highfalutin. Traditional food that is not in a packet. And you mentioned one thing. You mentioned we're looking for something fast for the children. And I get that. I get that we're busy. Hey, I'm a cardiologist, I'm as busy as they come. But, we also need to think about our future because even if you're busy today and you're eating what you shouldn't eat, it tells on your body later. Okay. Now, how can you eat healthier when you're busy? You can meal prep. Okay. You can meal prep and store. And it's easier for those of you abroad that don't have NEPA problems. So you can buy fresh vegetables, portion them into salads and store. You can cook. You can cook maybe once a month or once a week and store. Or you can get someone to cook for you to your specifications. So that's what I do. I have people that cook for me to my specifications. My caterer knows I don't eat too much oil. She shouldn't put excess bouillon cubes in my food. And once I'm tasting salt, you're in trouble. I don't see oil floating on top of my food. So and she's like, Dr. Money, this your food is not sweet. I said, leave it. That's how I like it. I don't want it to be sweet because you caterers are used to too much bouillon, bouillon, bouillon. Your food is tasting one kind. And it took a while, to train her to cook how I like. So what I do is, so when I give her a call. Okay, I want a foriro, okra, blah blah blah, and I tell her what I want, and she knows how to package it in single serving sizes, and I put that in my freezer. And all I do is, once we get home for wherever, quickly boil rice, warm a bowl of stew, and everybody eats. And it doesn't take time. And then learn to train your children to be independent as well. For me, my kids are super independent. whenever I'm in, like I told you today, today was my lazy day. I'm in bed all day. When my kids were young, they know Sundays, mommy doesn't cook. Everybody knows how to sort themselves out. You understand? Your kids should know how to, get themselves a sandwich. you know your kids should know, so that mommy is not stressed all the time. Your husband is not an invalid. I'm sorry, a lot of women may not like this, because of traditional African values. Daddy is completely useless. Daddy should also get himself a plate and fix one for me too. Because the truth is that, when we women behave like we're super women, everybody leaves us to do everything ourselves, and that's why we now turn to, fast food, food in packet, just open packet and warm, and that's why our kids are suffering. We have an obesity epidemic in children, and it's because of all these ultra processed foods we are all eating.
Absolutely, absolutely, and I agree with you. I think again, when it comes to our local produce, it's something that I always encourage. Something I've seen my mom. My mom is still alive; she's in her 80s, and she still cooks herself her meals, and she cooks from scratch. She goes to the market, the fresh market close to it's close to her house, and she buys her food fresh. She doesn't even go to the supermarket because she doesn't believe that the supermarket sells fresh enough produce. And I know I'm always trying to tell her mom, I'm sure that the supermarket sells fresh produce. But I always believe that there's something about eating food and cooking food from scratch and just kind of, making sure that you are getting all the right proportions of food in place. I know there is a lot out there about all sorts of diets. By the time you look at all the different diets in the world, you would begin to like, well, it's so confusing, very, very confusing. But I guess again, when you stick to the common sensible rules of kind of eating, regularly, plant-based diet and reducing salt, especially salt for people who already know they have risk factors or people who already know they have a family history, then it's really important to kind of align your diet as best as possible right from an early age. And I know there is always this
Mhm.
concept because my name is Jai and I kind of use my name as Jai. Some people feel like, I've come to enjoy my life and they always see it like
Mm.
you have to enjoy life. You only live this life once,
Oh,
and you want to enjoy it. And there's no
I
point.
agree. I agree. But you can't enjoy life every day. So there's an 80-20 rule in everything. Once you eat properly 80% of the time, then you're good. That 20% can be your jaye. So your jaye can be, maybe you went to Owan Bear and they're serving amala with plenty, plenty inside of meat. Fine, eat. No, I don't believe in restricting yourself, but you can't jaye every day. That's where the problem lies. We want to enjoy every single day. We want to eat chocolates every day. We want to eat biscuits every day. We want to drink soda every day. That's the problem. We want to drink alcohol every day. Look at the 80-20 rule. If you eat right 80% of the time, you'll be good.
Hmm. I like that. I like that. And I think that is even if you follow that simple rule of 80-20, 80% of the time you're eating your, very healthy diet. 20% of time, you don't have the, extra bits here and there. And it's just about doing things in moderation. I know there's a lot of information out there about, what kind of supplement. Would you recommend people have any supplements? For example, things like omega H3 or anything along that line. What are your thoughts along those lines?
Okay.
Because not many people, I mean, for example, in the UK, many people don't eat fish regularly, and we know fish has got a lot of omega 3. What are your thoughts about supplements that people can use to kind of boost their diet if they are struggling to meet up with the recommended daily intake?
Okay. Supplements I have a love-hate relationship with, because many people abandon what they should do and then they focus on supplements. Now, why don't you eat fish? I'm not saying go and buy salmon. Salmon is expensive. Buy fish that you can afford. It's better to eat fish than to supplement. You understand? I approach supplements from a point of deficiency. So if you have anemia, for example, then take iron supplements. If you have a vitamin deficiency, then please, take the supplement related to whatever deficiency that you have. But not some people just wake up, they won't eat good food, but they'll go and buy a bunch of supplements. So they won't eat properly. They will be eating junk biscuits, and then they now go and buy a truckload of supplements and be popping pills and saying, "Oh, I'm supplementing." No, that's not how supplements work. Eat properly first. Okay? Eat properly first, and then you can now add on supplements. Now, you mentioned fast food, and I always tell people most restaurants have a healthy option, but we don't ask for it and we don't look for it. Typical example, whenever I travel with my children and we go to all these fast food places, everybody has at least a salad on their menu. Everybody has a salad on their menu. The day I saw a salad in McDonald's, I was like, okay, even McDonald's has salad. IHOP, International House of Pancakes, has this steamed vegetables. Many of them have salads on their menu, but we ignore that and we buy the burgers and the fries and the things we shouldn't be eating. You understand what I mean? So even in
Yes.
fast food places, you can get a salad, you can get a chicken that is grilled and not breaded, and that's already a meal. And then you
Mm.
go easy on the dressing. They give you the dressing in the pack. It's not on the salad, and just use a bit just to lubricate it. And you've eaten a good meal at a fast food joint. So please, supplements should do just that. Supplement your food. They shouldn't take over. So, having said that, supplements that are good for you would include omega 3, CoQ10, vitamin B, all the vitamin Bs, vitamin C in small doses because too much of that can cause problems, vitamin E, vitamin D, selenium, zinc, magnesium. That's it.
That's that's amazing. That's amazing. That's quite eye opening. And again, it's just that emphasis on placing, eating your food as it is. Obviously, if you're deficient of any iron or vitamin D, that's fine. You can, or vitamin B12, for example. But if you use all the money that you're using to buy supplements to actually focus on having a good meal, at least 80% of the time, that will go a long, long way in helping you to have a healthier diet and a healthier outcome for your heart, whether or not you have a family history of heart disease or not. Now, I would come to the next bit, and I know you mentioned having regular checkups. I mean, you mentioned once a year. Is that general? Is that something you would recommend for every woman, or would you recommend it from a certain age that they should have a regular checkup? What are your thoughts about that?
So, to be honest, we're seeing hypertension in 18-year-olds now. We're
Wow.
seeing hypertension in 19-year-olds now. So don't wait until you are 40 before you check your blood pressure. And these things are easy. Checking your blood pressure is as simple as walking into the nearest pharmacy, and as well as checking your blood sugar. And if you are a market woman, they carry fig in the market, 10 naira, check your BP. So not knowing your blood pressure should be a criminal offense, really, because they are checking blood pressures everywhere now. Even in airports. At the airport the other day, someone asked me, "Madam, can I do your vitals?" So you should know your blood pressure. So once you are an adult, meaning that once you turn 18, you should know what your blood pressure is, at least, and what your blood sugar is. And based on that, you can now just keep checking maybe once a year, or more frequently, depending on what the result is.
Okay, fabulous, fabulous. I didn't realize it was that easy nowadays for even people, market women, to have their blood pressure. So there's no excuse really for anyone, whether you're at work, you're at home, you're traveling, you can easily have your blood pressure checked anywhere and you can take action. There's a lot of dependable healthcare professionals that you can approach, to get, I mean, please stop doing just Instagram. Like you always want Dr. Muni on your Instagram pages, that please stop doing Instagram consultations. Go
Ah,
and do your proper check with a
exactly.
registered healthcare professional. Check your blood pressure, your blood sugar, your cholesterol, your weight, your height, your, I mean, some people say BMI is not the greatest, but at least it is something
It's a
to
step in the
help you
right
get
direction.
started in the right
Exactly.
direction. What do you think? A lot of people do all this consultation. They go on TikTok, they go on all these things and hear things, but there's a lot
So
of hearing, but I don't see a lot of doing. People just want to sit down and watch, but they don't want to take action. What do you
so
think?
so so we have become really complacent and we have become extremely lazy. We expect somebody to come and help us. And the truth is that
Mm,
nobody's coming to save you. You have to get up. You have to get off your couch. And I don't think it's poverty. I'm sorry. I'm one of those people that I don't think for majority of course there's some poor people. That I totally understand. But for majority of people, it's not poverty, it's priorities. Because the same person that does not want to pay you and I for consultation will go and buy a wig and buy ashwebi and sew it. The same person always has makeup on. The same person, will go to party and spray. Even if it's 10 naira spraying, they will still spray. The same person will buy brand new shoes when they don't need them, but they will not go to a general hospital and pay 500 naira to see doctor. So it's not poverty. It's not poverty.
mm,
It's priorities.
mm, mm. I absolutely, and there is no time to begin to make your health priority a priority. It starts from now, really. Like you've mentioned, we're getting earlier and earlier diagnosis of what we call these risk factors: hypertension, obesity, and high sugar levels in younger people. So there isn't, in a way, there's no more excuse. If you're beginning
No.
to see the physical and outward signs, for you to even see the physical and outward signs, that means there's a lot of internal changes going on. So really, you shouldn't be waiting till something happens before you get
Yeah.
help, isn't
Yeah.
it? Take
Yeah.
control of your heart health. I think that is what I'm hearing this evening, Dr. Moni. If
That's
you
it.
had one piece of advice for women, at whatever age, if you had one big piece of advice, what would that be? What would that be?
It's not selfish to prioritize yourself.
Mm,
It's not. Because you cannot give what you don't have. You can't, we all say these things. You can't pour from an empty cup. But think about it. If you are not healthy, you cannot care for this family you claim you're caring for. So you need to prioritize your health first, and then you can help your husband and your children, and never feel guilty for taking care of yourself, because it's only a woman that is alive that can take care of the family. And I tell women, once you do, you stress yourself, you have heart disease and you die, your children will move on and your husband will move on even faster. So there you go.
absolutely. Absolutely. I 100% support that. And I always say to people, when women thrive, communities thrive. And there's no doubt
Yeah,
about it. There are so many lives linked to yours as a woman. There are of course, there's your children, there's your husband, but there are other people you cannot see. And I can certainly say that if if I did not meet Dr. Moni on Instagram, I mean, I'm sure we don't know any of you each other from anywhere. I only met you on Instagram, but you have challenged me. You have been a role model to me. And how much more other women that are linked to Dr. Moni's life. And it's so important. You may not see the people who are linked to your life, but you are there constantly cheerleading other people, constantly giving people permission to do things and you may not even know. But if you don't look after yourself, then there's that risk that those lives, those communities linked to yours may not see the light that you carry. And that is why I'm very passionate about what I do. And I always talk about
Well done.
women's health, not because men's health is not important, but I believe that the woman is like the glue that holds fabric or the glue that holds society together. And if I can focus on one woman at a time, whether it's your heart health, whether it's your hormone health, whether it's, their whatever their gastrointestinal system, if I can help them improve that aspect of their life, then I think I have helped the community in that
You have.
way. So
You
thank you
certainly
so
have.
much, Dr. Moni. I really appreciate the insights you have given
Yep.
us. I think for me, one key takeaway is how you have explained how stress can cause so much, especially the link to stress and the metabolic changes, the obesity, the hypertension, and also the high cholesterol, which again are the risk factors for heart disease. But also the fact that sometimes when women have a heart attack, it's not obvious. It's not the classical signs that we see in the movies. And it's really important to just be aware, take control. And that's why I love what you say. Self care is not selfish at all. It's from that cup that you will give out to other people. Thank you so much, Dr. Moni.
Yeah.
Dr. Moni, can you tell us where we can find you? And if we
Uh,
whether or not it's to have consultations with you or just to learn from you, can you tell us where we can
okay.
find you?
Okay. Of course, you can find me on Instagram. My Instagram handle is at dr doctor. Sorry, I beg your pardon. At dr underscore MoniAdanijo at Dr. Moni Adanijo. Okay, number one. But I live in Lagos, Nigeria, like I said, and I consult as first cardiology consultants, prominent heart health, critical care hospital in Lagos, Nigeria. But you can follow me on social media on Instagram, Dr. Dr. underscore MoniAdanijo. Also on TikTok and
Amazing.
the same name on TikTok as well.
Amazing stuff, amazing stuff, amazing stuff. Well, that's it for today. Thank you everyone for joining us. Thank you for keeping with us, especially those of you on YouTube. Thank you for being with us and watching us. There were a couple of blips along the way, but I'm hopeful that by the time you listen to the podcast, we would have a very clear, beautiful sound for you. But once again, Dr. Moni, my heart is full of joy. And all I can say is Happy Mother's Day. Thank you for being a mother. Thank you for being a role model. Thank you for mothering a lot of us that you don't know. I appreciate your time and your efforts for joining us today.
You're welcome. You're welcome. Have a good week ahead.
I will do. All right. Bye, everyone. Thank you once again.